Hepatitis B is now becoming alarming, and that is because a lot of people don't know what is this infection. They don't even know what causes this infection. They don't know its signs and symptoms. They don't know how to prevent this particular infection, and that's why a lot of people are now having it. And let me shock you in case you don't know, hepatitis B infection is more deadly than HIV. When this infection gets into your body, it destroys your liver, and the liver is one of the major organs that is responsible for metabolism. So that is why in this video today, I'll be telling you what is hepatitis B infection, how to prevent this infection, how you would know you are having this particular infection, and how to manage this particular infection in case you are having it. So do well to watch this video to the end. And if you are seeing my face for the first time, do well to hit on the subscribe button so you can be getting more videos like this. Now, hepatitis B infection is a viral infection that affects the liver. And once this infection gets into the body, it makes the liver to be inflamed, and when it's not being managed at early stage, it gets destroyed. It can cause liver cirrhosis, it can cause liver cancer, it can cause liver failure. And liver is one of the major organs that helps in metabolism in the body. It helps in breaking down nutrients in the body. It helps in removing toxins in the body. It helps in producing some kind of hormones in the body. So when you don't have liver, or when your liver fails to function because of hepatitis B infection, then your body is as good as nothing. And that's why it's always good to take care of your liver. And one of the ways you can take care of your liver is by preventing hepatitis B, and that's what I'll be explaining by the end of this video. Now, hepatitis B infection does not just get into the body just like that. There are ways in which this particular infection is being transmitted into the body. There are ways in which you can contact this particular infection. And one of the ways we as humans can contact this particular infection is through unprotected sex. If you're having regular unprotected sex with maybe multiple partners, or with partners that are infected with this particular infection, then you can have this infection. Then it's not just about vaginal sex, anal sex, or whatever. No, oral sex can also make you have this particular infection, because the virus that causes hepatitis B is found in vaginal fluid, is found in semen, is found in blood, is found in saliva and other bodily fluid. So if any body fluid is being exchanged within partners, then you can have this particular infection transmitted into your body. And that's why I said it is more deadly than HIV. And not just deadly, there are more ways in which this infection can be transmitted to other persons than HIV. Now, the other way in which this infection is being transmitted is through vaginal delivery and through breastfeeding. As a woman who is infected with this particular virus, if you have not been taking your antiviral medications while you are pregnant, when you are about delivering your baby, you can transmit this particular infection to your baby. And even while breastfeeding your baby, if the baby escapes the process of delivery, the baby can still get this infection from you while breastfeeding your baby. And that is why it is always advisable you go for antenatal while you are pregnant. And if you're having this infection, make sure you are on antiviral medications so that the viral load of this particular infection will be drastically reduced to prevent you from transmitting it to your baby or your husband. Now, one of the major questions that a lot of people ask is, how can we know we are having hepatitis B? How does hepatitis B shows itself in the body? What are the signs and symptoms of hepatitis B? One of the ways you will know you are having hepatitis B is if you're always having yellowish discoloration of your eye. If you are that kind of person that have not gone for tests, you have not checked yourself before, and you're having a yellowish discoloration of the eye all of a sudden, or maybe gradually, you just start experiencing your eye turning yellow, your skin turning yellow, you're having dark urine, your abdomen is always swelling, you're always having nausea, you're not feeling like eating, you want to throw up. These are the major signs and symptoms of hepatitis B. If you're having a dark urine, you're also having a sign of hepatitis B. And that's why it's always advisable, if you're having any of these signs and symptoms, you have yourself checked in the hospital so you will know if it is hepatitis B. Mind you, other conditions in the body can come alongside with all these signs and symptoms I've just explained. But these are the major ways in which hepatitis B shows itself in the body. And there are ways in which you can prevent this particular infection. It's not just an infection that cannot be prevented like that. No, it can be prevented, and the prevention is free of charge if you know how to prevent it. And one of the major effective ways in which you can prevent this particular infection, which is hepatitis B, is through taking its vaccine. There are vaccines, hepatitis B vaccine, that can be taken to prevent you from having this particular infection. So as a person, in case you have not taken this vaccine before, or in case you have not had yourself checked, the first thing you need to do after watching this video is to have yourself checked in the hospital to know if you're having this infection. If you're having this infection, number one, try to take antiviral medications so that they can reduce the viral load of this particular infection. And number two, if you're not having this infection, do well to have yourself vaccinated so you can be assured of its prevention completely. And I know most people will not be asking questions like, how can we manage this infection in case we're having it? What should we do? That's the question that a lot of people will keep asking. Now, one of the things you should do is to change your lifestyle. As a person, make sure you are using protection while having sex. Number two, make sure you discuss this with your partner so that your partner can know you're having this infection, and your partner can also have himself or herself vaccinated to prevent him from getting this infection. And also make sure you are on antiviral medication so that you can have your viral load being reduced. Because when your viral load is not reduced, that's when you have a high potency of transmitting it to others. But when the viral load is reduced, then you can live as a healthy carrier. They can even carry out tests on you and it will show negative, but you are still infected. And that shows the infection might not be transmitted to others as those people who are not taking the antiviral medications. So if you enjoyed this video, do well to hit on the subscribe button so you can be getting more videos like this. And if you also wish to ask questions about this particular topic, do well to drop it in the comment section so we can discuss about it. And don't forget, your contributions are always welcome. Drop them in the comment section so we can broadcast more on it. Thank you for watching this video. I will see you next time.